Behavior chain analysis is a systematic and analytic approach to understanding behavior. It helps us to gain important understanding before beginning interventions with our clients. The process of behavior chain analysis begins with identifying the target behavior, the behavior that's targeted for change. And then we look at setting events. Setting events are the conditions that influence the likelihood of an event occurring. Then we look at the antecedents. These are triggering events for behavior or factors that contribute to the likelihood of a behavior, and these can include emotional, social, and environmental factors. We also look at the behavior, the actions of the behavior, including the steps that lead up to the behavior. And finally, we look at the consequences. These are the immediate and long-term effects, including physical, social, emotional, relational, legal, financial, academic, or occupational experiences and problems that arise from the behavior. And these may include pleasant and unpleasant experiences and sensations. Behavior chain analysis can give us important information that can help us make decisions about where to intervene in the chain. Maybe we want to intervene even before the chain begins at the setting events, reducing conditions that will influence events. We might want to intercede at the antecedent stage, eliminating or minimizing triggers, especially environmental triggers. We might want to intervene at the behavior stage, identifying appropriate and healthy alternative behaviors to engage in. Or at the consequence stage, identifying alternative ways to contact pleasant consequences and increasing the potency of unpleasant consequences. So this chain really helps us make some important decisions as we're determining the appropriate interventions for our client. As we involve our clients in the behavior chain analysis process, we can use this as a framework for their self-reflection and introspection. It can help our clients gain self-awareness, identify patterns of behavior, and recognize factors that are influencing their behavior. And this can lead to personal growth, making conscious, positive choices, and a sense of personal empowerment in their own lives. Behavior chain analysis is a really good tool to use when you have a client who's engaging in risky behaviors, including substance abuse, intoxicated driving, smoking, or aggressive behaviors, unhealthy habits, behaviors that create distress, harm, or disruption in their lives. So it's a really good tool. It's a part of community reinforcement approach as well as dialectic behavior therapy. Clinical behavior analysts use it a lot, and I'd like to go through an example of what it would be like to use behavior chain analysis with a client who our targeted behavior is substance use, drug use. As we begin this behavior chain analysis, we're looking at the setting events first. Those are the conditions that will influence the likelihood that if a trigger is present, it will be more effective or it will lower the willpower of the client to resist the temptation. Then we'll look at antecedents, the factors that contribute to substance abuse, the factors that are triggering their desire to use. Then we'll look at the behaviors. These are all of the actions of substance abuse, including acquiring, preparing, and consuming the substance. And finally, we'll look at the immediate and long-term effects, including social effects, including academic or occupational effects, physical effects. We'll be looking at the whole scope of the consequences. When we're analyzing setting events for drug use, we're looking at kind of the conditions that exist in the person's life that might make them either less likely to reduce the temptation of a trigger of an antecedent or more likely to be susceptible to a trigger or an antecedent. And these things might be environmental conditions. They might be things like lack of sleep and fatigue, a change in medications. They can also be related to individuals, the presence or absence of a specific individual who adds more peer pressure or adds more social support. They could also be the rapport between individuals and whether when one person is present, somebody is more likely to be feeling anxious or upset or depressed. And so when a trigger comes, when an antecedent is present, then they're more likely to engage in that problem behavior. So we want to be looking at these kind of setting events, the conditions, and how they influence behavior. There's a huge number of things that can serve as antecedents for drug use that we might be analyzing. Often we look at things in the four categories: stress, social situations, the availability of the drug, and challenging emotions. So we might be looking at stress at school or work, stress in relationships, or stress with personal challenges. We might also be looking in social situations if there is social pressure present or social temptations present. How available is the access to the drug? That is often a trigger or an antecedent for drug use. So, is there easy access through personal possession? Is there easy access to others in possession who might share with them or give it to them or sell to them? Or is there proximity to locations where that drug is available? And we also look at challenging emotions, which can be hard for behavior analysts to kind of quantify and to be able to track and observe, but it is important that we keep these in mind when we're analyzing antecedents. So, self medication from sadness, anxiety, or frustration is a common trigger and antecedent for drug use. So, we want to watch, is the person experiencing large levels of sadness, anxiety, or frustration? And so, is that a trigger to self medicate through the use of the drug? Often in a target behavior such as drug use that we want to reduce, there's actually multiple behaviors present. And so we want to analyze those behaviors. So those might be behaviors around acquiring the drug, seeking out and obtaining the drug, for example, contacting a dealer, visiting a specific location, or asking a friend for the drug. It might be preparing a drug, depending on the type of drug they're using, for personal use, measuring a dosage or rolling a joint, that sort of thing. It could also be consuming the drug, which is what we're usually thinking of. It's actually taking the drug, whether that's ingesting, smoking, or however they're consuming the drug. But we want to analyze those behaviors. What behaviors are involved in the problem behavior? And finally, it's important that we analyze the consequences so we unravel what the consequences are for our clients. In this example, if we're unraveling the consequences for drug use, we're looking at the immediate effects that they experience, the social effects that they experience, and the long-term effects that they experience. So immediate effects might be an altered mood. Things might be feeling pleasant, euphoria, relaxation, reduced stress, maybe temporary escape from negative emotions, and that escape could be really important, an important part of the function for them. There's social effects, so it might be a sense of belonging in a group, attention, peer approval, acceptance by others. Those might all feel positive when they do the drug. That might be something that is a motivating factor for them, a function of drug use that we need to be aware of. There's also long-term effects of the drug use, so we might be looking at things like addiction, which is a very negative effect, physical health issues, mental health issues, strained relationships, academic problems, occupational problems, legal problems, financial difficulties. Now, our clients may be more aware of the immediate effects and the social effects. And so, by unraveling all of these consequences and really bringing to their attention the long term effects, it can help them make informed choices and decisions and help motivate them to be more participatory and willing to be involved and to follow some interventions if they really are recognizing and contacting what these long term effects are. Sometimes, since these effects can take longer to contact, they don't feel like consequences immediately. They feel disconnected from the behavior. And so, by doing this behavior chain analysis, we're reconnecting that and making sure our clients have that awareness, and also that we're acknowledging that these are real consequences of their behavior. Behavior chain analysis is used by many behavioral and mental health professionals, and many of them will use slightly different terminology than we would in behavior analysis, and that's fine. I just want you to be aware if you see some forms or some charts that you might be interested in using. Setting events is sometimes referred to as a vulnerabilities section, and it will be talking more about how That area is identifying when individuals are more likely to respond to a triggering event. It's very similar to setting events. You might also see that an antecedent events or triggering event section could be called cues or links to behavior, and that's fine too. It's just different terminology for substantially the same thing. Learning how to conduct a behavior chain analysis is a really valuable skill for behavior analysts. So, this is a rich opportunity to accrue some supervised unrestricted field work and then just some general unrestricted field work. So, I've included some research and some forms and some questionnaires that you could use to gather the information that you need to identify the setting events, the antecedents, the steps in the behavior, and the consequences. So, you could modify those so that they're appropriate for the target behaviors that you're working with, so that they're appropriate for the populations that you are working with who are your clients. And you could submit those as evidence, and we could discuss those in an upcoming supervision meeting. We could also discuss if you have a client who is currently addressing one of these issues, such as smoking or drug use. We could discuss the behavior chain analysis that you do with that client, anonymize the client information, send me the evidence of that, maybe send me the behavior chain overview, and we can discuss that in an upcoming supervision session, and that could be supervised unrestricted field work. Now, we can do that the first time that you do it, it's supervised unrestricted fieldwork, but you could do for unrestricted fieldwork behavior chain analysis for multiple clients. You could gather some research and continue to develop some skills in this. Have some different forms for different problem behaviors, questionnaires that will help you ask the right questions to find out what the setting events are, what the antecedents are, those sorts of things. And all of that would be unrestricted fieldwork that you would record as behavior chain analysis work in your fieldwork tracker. So this is really a valuable tool to have in your professional tool belt. So I hope that you take advantage of this opportunity.